Hello, my name is Olivia Ash, and I'm a compliance consultant with Compliance Dashboard. This short video is going to run down some reminders with respect to HIPAA for covered entities. You're a covered entity if you're a health care clearinghouse, a health care provider, or a health plan. Specifically, this information is going to be a reminder for health plans and those benefit plan managers who are working day to day with HIPAA rules and guidelines. Two things in this video. I'm going to run down a few reminders about the HIPAA rules for benefit plan managers to consider, as well as discuss the notification of enforcement discretion recently released by the Office of Civil Rights regarding business associates and telehealth and how that intertwines with HIPAA. So first things first. Remember, HIPAA is still in effect. PHI is still PHI. So the privacy and security rules are active and in place for covered entities. And PHI that is created, received, maintained, or transmitted by the health plan is still protected. If health information, however, is voluntarily disclosed by a patient or an employee to an employer, that is not PHI under HIPAA because it's not coming from the health plan, but it is confidential information and needs to be treated as such. So this might be information regarding FMLA or workers' compensation. Review HIPAA regulations, specifically the permitted and required uses and disclosures, and it may be a good idea to take a look with your counsel. The information I'm providing is educational and is not to be construed as legal advice, but we wanted to summarize what we have seen in the regulations and remind you that HIPAA still applies. Now, here's a few things. A covered entity, so in this case, let's think about a health plan, an employer who provides a health plan. They may disclose PHI about a patient, so in this case maybe a hospital instead, as necessary to treat the patient or a different patient, including coordination of health care by one or more providers. A covered entity may disclose PHI without an individual authorization to a public health authority, like the CDC, at the discretion of a public health authority to a foreign government agency, or to persons at risk. PHI may be shared with the patient's family members, relatives, friend, or others as identified by the patient and as necessary to identify, locate, and notify family members. This may include the police, the press, or the public at large. To prevent or lessen a serious and imminent threat to the health and safety of a person or to the public, if applicable, PHI may be shared. Generally, reporting to the media about an identifiable patient or their health and test results may not be done without a written authorization. And then, of course, PHI disclosures must continue to meet minimum necessary guidelines to accomplish the intended purpose. Let's move on to two notifications of enforcement discretion released last week by the Office of Civil Rights. So this is regarding permitted and required uses and disclosures by a business associate and then a covered entity. And essentially what the Office of Civil Rights is saying in these notice of enforcement discretions is we're going to give everybody a little grace to permit them to use and disclose PHI as necessary for public health emergencies, even if it's not explicitly outlined in a business associate agreement. And so that's the first notification of enforcement discretion. So typically, a business associate agreement must be in place between a business associate providing services to the plan and the covered entity who is needing those services. And within that business associate agreement, there are permitted and required uses and disclosures. And unless it's explicitly outlined, a business associate can't share that information with a public health entity or for public health emergency situations. Now, the Office of Civil Rights has said, look, we're going to exercise our enforcement discretion and we're not going to impose potential penalties for violating HIPAA privacy rule against health care providers or their business associate for uses and disclosures of PHI by a business associate for public health and health oversight activities during the COVID-19 nationwide public health emergency. And that brings up an important point. During the public health emergency. So these notifications of enforcement discretion are in effect until the Secretary of Health and Human Services says that the public health emergency is no longer exist, or the expiration date of the declared public health emergency goes into effect. So the Office of Civil Rights will enforce discretion and not impose penalties on a business associate or a covered entity only if the business associate makes a good faith use or disclosure of a covered entity's PHI for public health activities or health oversight activities, and the business associate informs the covered entity within 10 calendar days after the use or disclosure occurs or begins for recurring uses and disclosures. And again, typically, it's only expressly permitted in most business associate agreements, but they need to free things up to make sure that data gets where it needs to be for health and safety purposes. All other provisions of the privacy rule are unchanged. Security rule provisions for business associates and covered entities are still in effect. And last, the notification of enforcement discretion regarding telehealth. So now a covered healthcare provider can use any non-public facing remote communication product available to communicate with patients. They won't impose penalties, that's the Office of Civil Rights, for non-compliance with rules in connection with the good faith provision of telehealth using non-public facing audio or video communications during the public health emergency due to COVID-19. The exercise of discretion applies to telehealth for any reason. And Facebook Live, Twitch, TikTok, and other similar video communications are public facing and should not be used in the provision of telehealth. Now, most important here is that OCR will not impose penalties against these covered healthcare providers for lack of a business associate agreement with video communication vendors or any other non-compliance with HIPAA rules that relates to good faith provision of telehealth services during COVID-19. So as you can see, we have, in summary here, we have this sort of giving a little bit of grace by the Office of Civil Rights for business associates and covered entities to allow the flow of PHI to public health officials and health oversight activities as long as there is good faith effort and there's notification. And again, covered healthcare providers can use what they need to have telehealth appointments with individuals since we are in a time of social distancing. And then remember, HIPAA still applies for everybody to whom it applies to. So covered entities and their business associate. HIPAA is still there. And remember, if you have questions about what PHI is, ask. If you are working day to day and somebody asks you a question and your red flag goes up, I would ask. It never hurts to ask. And so thank you for watching this video. Please read any information that we have provided to you. We also have a great resource page on the COVID-19 regulations. And I wish you all a wonderful, wonderful spring, and hang in there and stay safe. Bye.